Namaste and welcome to the next lecture of Clinical Ayurved. Myself Dr. Mayuresh Agte. We were discussing Guduchi as a Dravya and a clinical application of Guduchi. I will again repeat, I am taking much more time on this Dravya because I want to set up a ideal specimen how to learn or apply the drug in the clinical practice. So we have come across the first three lines of the Guduchi, and now today we will go with the last line, which is Kamala Kushtha Vatastra Jwara Krumi Vamir Harit. So first is Kamala. Now we all of us know the Kamala is the disease of main Ratta Srotas, and it is of in relation with the Yakrut or liver. So how Guduchi will be useful in this Kamala? Let us see the first types of Kamala. First is Bahupitta Kamala and Ruddhapatha Kamala. So in Bahupitta Kamala there is excessive secretion, excessive production of the Pitta, and that Pitta gets spread all over the body. When I am going to take Nidan, Kamala Nidan, we will discuss this factor in detail. So Guduchi itself is a best drug on the liver. It is a very good liver stimulant. Then Tiktaras is Pitta Shamak. So in Bahupitta Kamala, Guduchi is useful. Again, you have to manage with the Ushnavirya. So Siddha Gruta, Guduchi Siddha Gruta, Guduchi Sattva will be the better choice. In Ruddhapatha Kamala, this is the next type of the Guduchi. I had told you in last lecture somewhere that Ruddhapatha, there is Avrod and it requires Tishna Guna for the Bhedan Karma of that Avrod, Bhedane Tishna. And Guduchi doesn't have Tishna Guna. So, the Bhedan Karma in Ruddhapatha Kamala, the Bhedan Karma, if you are expecting from the Guduchi, then it doesn't have a Tishna Guna as such, but for a better result, to have action on Yakrut and also have a Bhedan Karma, you can use it, the Guduchi, in the Arishta form, Amruta Arishta. So, as Arishta little bit have Vyavahivika Sukshma Guna, this Kalpana of Guduchi will be useful other than other Kalpana. Of course, again, it doesn't have Tishna Guna, so to break that avrod, you will require some dravya with Tishna Guna like Chitra, Kumari, etc., Katuka, etc. So, main use of Guduchi will be in Kamala, it will be in the Bahupitta Kamala, and in Ruddhapatha Kamala, it will be assisting dravya with other Tishna Gunatmak dravya. So, we have seen Pandu, we have seen Kamala, and next is Kamala Kushtha Vatastra. Kushtha, again, as we generally take it as a skin disease. And what happens in the Kushtha? In short, that the clay is increased. Now, which clay? It is Rattagata clay. And hence, Varna Karma is dependent of the Varna Karma of the skin is dependent on Ratta Dhatu. In this Ratta Dhatu, clay is increased, and because of this increased clay in Ratta Dhatu, the skin Varna gets disturbed, and we call it as a Kushtha. Now, what is the importance of Guduchi in this Kushtha Vyadhi? First, it is disease of Ratta Dhatu. So, Guduchi itself is the best dravya, or it has got a great gamitva on Ratta Dhatu. Secondly, Tikta Katu Ushna Laghu Ruksha, all the guna of Guduchi are Kledanashan. So, this is the second aspect where in the Kushtha where Guduchi is useful. Third important aspect, as it is working on the liver and Ratta Dhattvagni, so what will happen? Dhattvagni will be improved automatically because of Guduchi, and because of the Ratta Dhattvagni's good quality, the next Ratta Dhatu which is going to be formed will be of a good quality. Automatically, this good quality of Ratta Dhatu will create a proper or good varnya karma in the body. So firstly, Gamitvan Ratta Dhatu. Secondly, in Samprapti there is Rattagat Kleda, which is will be taken care by Guruji's all properties mainly. Third, then because of Ratta Dhatu Nivardhan, the dhatu which is Ratta Dhatu which is going to form in the next future will be of good quality, and so Varna Karma will be restored. So this is the main aspect why Guruchi is the drug of in the good drug of the in the Kushta also. Now you will see that disease of Ratta Dhatu I have described I think in previously somewhere, that why Ratta Dhatu is important. It has got various shades in the Samprapti of different diseases. Ratta Pitta is different, Kushta is different, Pandu is different, Kamala is different, Vataratta is also different. But Guruchi will be useful in Ratta Pitta by using Gurve Sattva, Shita Viryatma. It is useful in Pandu because of Ratta Dhatu Nivardhan. In Kamala, it is useful as a Pitta Shaman. In Kushta, it will reduce Rattagat Kled. And in Vataratta, which we will describe now, it is useful by action on Vata Dosh as well as Ratta Dhatu. So both elements of Samprati will be neutralized. So all these various shades of Ratta Dhatu disease, Guruchi has a good action in every aspect of the Samprati of these different diseases, and hence Guruchi is the very much important drug in the Ratta Dhatu disease. When you will say that a drug has good action on Dhatu, always think that that Dhatu is involved in which Sampratis of diseases, and whether that drug has effect on those Sampratis, or one, or maybe not every time it will be useful in all Sampratis, but if that particular drug is covering the majority of Sampratis of the diseases, then you can say that it is a very good drug, or it will be the ideal choice of in the selection and in the practice. So Guruchi is useful in all these aspects. Next is Vataratta. Kamala, Kushta, Vatastra. Vatastra and Vataratta. As we will discuss in Nidan in future, Vata and Ratta both come together and has got Samprati with the joint pain, etc. You all know that. So it is Ratta, Gamitva is Ratta Dhatu, and it is very good drug. Tidosh Shaman, so Vata Shaman is one of the factor. Hence, in Vata Ratta, Guruchi is a drug of choice, and it is useful in all forms. Churna, Ghana, Kvata Kalpana, Samshanivati, Amrutarishta. All these kalpana of Guruchi are useful in Vata Ratta. Kamala, Kushta, Vatasra, Jwara, Krumi, Vamir, Harit. In Jwara, in normal Jwara, Agnimandya, Ampachan and Jwara Dirvidi. Guruchi we have discussed in the second line only. It is Deepani, and so it is good Agnipan Dravya, Ampachan Dravya. So in Jwara, Guruchi is useful in this way. In Jirna Jwara, the Jwara has got a longevity for more than 21 days, and there is Dhatukshay. As Guruchi is Rasayan Dravya, you can use Guruchi as Jwara Nashak as well as for the restoration of Dhatu, and Guruchi Gruta is the drug is the Kalpana which is very much beneficial. In Vishama Jwara, you will find that Rasagata Jwara, Rattagata Jwara, etc. It is very good drug in Ratta Dhatu, as it has got Ratta Dhatu, Gamitva Ratta Dhatu, Dhatugata Avastha, Rattagata Jwara, and even in the Vishama Jwara, you will find Guruji as a good drug for Dhatu, to restore Dhatu as well as Amapachan. So, in Jwara, in normal Jwara, Ampachan, in Jirna Jwara, for restoration of Dhatu as well as Jwara Nashak, Guruchi is useful. Next is Jwara Krumir Vamir Hare. Now, in this case, Krumi we have discussed previously. It is got Ushna Virya or Rasa Viryapak of Kledanashan. So, media required for the Krumi Nirmiti and Vriddhi, that is Klep, is destroyed. Ushnavirya is directly Krumigna. In the Krumi's type, they have mentioned Rattaja Krumi, and Guruji has got a good affiliation towards the Rattaja Krumi. So, in that case, Guruji is useful by destroying the Rattaja Krumi also. Now, last is Vamir Hare. It is used to stop Vaman Achardi. How we will use? We can use by two ways. It is Tiktarasa. So if there is Rulas and patient is saying that if I get Vaman, I will be better if it is get thrown out. So just rub the Tiktaras of Guruchi on the tongue and it will provoke the vomiting. And if you want to Shaman Chikitsa to stop the vomiting, Gulve Sattva, which is of Shita Virya, will be drug of choice. In this case, you can give it with the Gruta as with a Anupan or Siddha Gruta, or even with the Madhu or honey, because that Guruchi plus honey, and if you ask the patient to just split, it will have action on this tract and it will be helpful to reduce the vomana. I have taken much more episodes on this dravya because I want to demonstrate an ideal specimen, how a drug can be applied. I have not purposefully I have not told you any amay prayog, any sanyog with that dravya, because it will be your choice that how you are going to use Guruchi with other drugs or its amay prayog. So we will stop today here. Thank you very much.